Welcome back. The South African Health Products Authority is recommending the lifting of the pause in the Sisonke study provided that specific conditions are met. The recommendation is based on the body's review of available data. Last week, Health Minister Dr. Zweli Mkhize announced the suspension of government's planned rollout of the Johnson & Johnson's vaccine. The move followed the United States' suspension of its own Johnson & Johnson vaccine rollout. That's because 6 people out of the 6.6 million people had developed blood clots after being inoculated. SAHPRA says their screening and monitoring of participants who are at high risk of the blood clotting disorder should be strengthened. Let's now discuss this further with Vaccinologist Professor Shabir Madhi from Wits University. Prof, thank you so much for your time. There was concern last week that the decision to temporarily suspend the rollout of the Johnson & Johnson vaccine would delay our vaccine rollout program, but it's always better to be safe than sorry. Was the last couple of days enough for SAHPRA to analyze the data and come back with this recommendation, giving the green light?
So good afternoon to you. So the short answer is I think SAHPRA did a correct thing, as did the Ethics Committee, in pausing the continued use of the vaccine in the context of a clinical trial. And we need to remember that it's not only SAHPRA that's looking at this data. Many other regulatory authorities are also reviewing the data, in addition to which the World Health Organization itself and experts that advise the World Health Organization have also been reviewing the data. And the consensus is that the risk-benefit ratio is far in favor of continuing with the vaccine, in that the benefit outweighs the risk. So I think it's a correct decision, both in terms of the pause in relation to the context of a clinical trial, as well as now the lifting of that pause and the ongoing use of the vaccine.
Do we know if SAHPRA looked at the data, that shows whether we've had cases of blood clots, whether it's cases that were reported or those that may have gone without being reported?
Look, the number of individuals that have been vaccinated in South Africa is just under 300,000. And with 300,000 individuals, we don't actually expect any such case in South Africa, where the incidence of this condition with the Johnson & Johnson vaccine currently, as you pointed out, is in the region of 1 in a million. With the other vaccine, including the AstraZeneca vaccine and the Pfizer vaccine, the incidence of the specific type of complication is in the region of 4 to 5 per million. So you would really need to be vaccinating millions of individuals before you identify a few such cases. So on its own, the 300,000 individuals that have been vaccinated, it's unlikely that we're going to see any sort of signal in that relatively small number of individuals that have been vaccinated in South Africa.
I see. So the regulatory authority has put down conditions that must be met when the rollout is resumed, and those include the monitoring and screening of participants who are at high risk of developing blood clotting disorder after vaccination. Participants, they also expect that must also be informed about the risks of developing blood clots. This is all important, but I'm just wondering if you think all of this could hurt public trust in vaccines.
So unfortunately, it probably is going to have some sort of impact in terms of public confidence around vaccines, but I think it's important for us to put this into context. As I mentioned, right now, the highest incidence that has been reported for these type of events, is about 4 to 5 per million. In South Africa, if we look at the excess mortality as an example of the number of people that have died of COVID-19, and even assuming only 70% of that excess mortality in fact is due to COVID-19, for every 1 million South Africans, there's been 1,800 people that have died from COVID-19.
Yeah.
So on its own, these numbers might be of concern, but I think it's really important for us to interpret it in the context of the bigger picture, where even up to now, we have hundreds of people dying of COVID-19 on a continent and thousands across the globe.
So SAHPRA has now made this recommendation that the pause be lifted. What's the next process before we roll out, that we continue with the rollout?
So I think a government now needs to make a decision. Remember, SAHPRA is separate from government, so government needs to make the decision as to whether it's comfortable to start rolling out the vaccine as soon as it becomes available. In relation to the clinical study that's been conducted for the J&J vaccine currently, the ethics committees of the study would need to make a recommendation as to whether they're in agreement to lift the pause on the ongoing enrollment of volunteers into the study.